Hi, myself Dr. Dignesh. I am a consultant Neonatologist at Ankura Hospital, Uppal. Many parents have a query regarding umbilical cord care. See, when the baby is in the mother's womb, umbilical cord is the only sole thing which helps in the transfer of nutrition from mother to the baby. And when the baby is out, we generally cut the cord almost like 1 to 2 centimeter and then we clamp it so that there is no oozing of blood from the umbilical arteries and veins. So, we advise the parents to keep the cord dry as much as possible, because if it is dry, then it falls off early. Generally, in most of the cases, the umbilical cord falls off within 5 to 7 days, and in some cases by 10 days. When the umbilical cord is intact, we advise parents not to make it wet. Do not apply any antibiotics or any creams on it. We ask them to just give a wiping bath to the baby, and generally when the cord falls off, we advise them after 48 hours to give a bath to the baby. And even after the umbilical cord falls off, there is nothing to be applied over the cord area, and most of the time it just gets dried off and then heals spontaneously. In only few scenarios there could be a umbilical granuloma, and even this granuloma generally it resolves within 2 to 3 weeks. But in case if it is not getting resolved, then we can apply the home remedies called common salt or rock salt, and if it is still persistent, then we can go for silver nitrate cauterization. And sometimes there could be a purulent discharge from the umbilical cord area, which has to be taken seriously, because the umbilical sepsis is a dangerous thing, because in long term the baby can get infected and can develop portal hypertension in future. So we need to treat it adequately. We need to take a swab culture from the umbilicus and start the baby on antibiotics and treat it adequately so that we can prevent the complication associated with it.